Okay, so let's talk about where you got lost from the very beginning. Like,
I guess when we got into the nursing process.
okay, so like what you were supposed to do as a nurse. That's kind of where we fell
Like,
apart there.
I don't know. I'm very lost right now. Like, even looking at my book, maybe it was like hard to follow along in the book. I don't know if it was just me, but like I know what you have in the PowerPoint is in the book, but like I couldn't find stuff for some
Okay.
reason. So I like
So
wasn't
let's do this.
listening because I was trying to find.
Go to the chapter, like the key points of the chapter, or chapter 29, and let's kind of just talk about that briefly and outline it from there. So for key points, this is page 320. Convulsion and seizures are terms that are used interchangeably to describe a convulsion, which is the sudden involuntary muscle contraction caused by changes in the brain's electrical activity. So a patient can have a seizure without convulsing. So that's what I wanted to make sure that y'all know. A patient can have a seizure and be on an anti-epileptic medication, and the only thing they might do is just stare. You don't necessarily have to convulse to have a seizure. Does everybody kind of understand that? Okay. So the other thing is that I wanted y'all to understand is seizures can be caused by disease. So you can have a seizure disorder. It can be caused by injury, such as a motor vehicle accident, or by metabolic changes. They can be inherited at birth. They can be caused by tumors. So it's important for us to know your patient's history in regards to assessment, because if we know their history, then sometimes that can lend us to know the type of seizures that they have. In regards to diagnostics, your patients are going to have an EEG. An EEG measures the electrical activity that's going on in their brain. That is how a true diagnosis often takes place beyond the visualization of a symptom. So like, I know Catherine was asking me, is that a seizure? I truly don't know, but an EEG would tell that. An EEG would, they would hook electrodes up to the patient's brain and they would watch those waveforms and they would be able to tell, is it a seizure or is it just an involuntary muscle movement that's taking place, while someone is sleeping. So anti-epileptic drugs, forget about the subcategories. Altogether, the drugs are used to depress the abnormal nerve impulses discharged in the brain. So when we talk, I might have messed y'all up because I was trying to pull from other stuff to kind of make it make sense to y'all. Whenever I started talking about the heart, and the reason I know that is because most people know the electrical activity of the heart, that it goes from the SA node to the AV node to the Purkinje fibers, and it causes the heart to contract. Most people kind of know that normal process. The brain has a very similar process. It has neurotransmitters, and then there's a nerve impulse, and then, all of these things are happening. When someone has a seizure, those nerve impulses, there's an abnormality. It's either firing too quickly or it's not firing soon enough. There is some sort of abnormality that takes place that causes the physical symptoms of a seizure. It's an electrical issue in the brain. So the medications, all the different drugs, they depress that abnormal nerve impulse. So whatever class they come from, they are interfering with that impulse so that whatever that abnormality is, they are interfering with. I'm not going to ask you guys specifics on these drugs as far as what their mechanism of action is. I'm not going to ask y'all that for this. For me, for the seizure medications, it's going to be more, or the anti-epileptic medication is going to be more your education, knowing the drug names, of course, but education and what you're looking for in regards to your assessment for these patients on these drugs.
So you're saying like the classes aren't like a big deal?
So I would like you to know what class they're in, but I don't necessarily need you to know that this class works specifically on the brain by depressing acetylcholine. You know what I'm saying? Like, I don't care about those in-depth mechanisms of action, but I do care that you know that dilantin is a phentoin, you know, and that the PAMs are benzodiazepines. I do care about that.
Okay. Another question I have is like, so the chapters usually like each class would have like its own section as far as like adverse reaction uses, reactions, contraindications. So is it basically saying like they're all very similar?
They are all very similar. What?
You're muted. You're muted, Ms. Trailer.
Very similar in regards to what you're looking for as a nurse. They are different. The gingivital hyperplasia that I keep talking about, that is specific to phentoins. Okay. And the phentoin, yes, PHENTO, or hydantoins. I apologize.
Oh, I was gonna say, I wrote down hydantoins.
I'm sorry. Phenytoin is the most common drug in that class, which is dilantin. I apologize. Hydantoins. So gingivital hyperplasia is specific to that drug class. And then specific to, I have a few more specifics. As far as benzodiazepines, specific to that drug class is the fact that elderly people must be monitored closely, and extreme drowsiness and lethargy are associated with that.
I mean, I haven't read, obviously, like, in depth, like I'm going to before I study, or while I study, but all this is in the book, those specifics, right?
It is.
Okay.
Yes. I'm still going to try to point some of them out to you because that's a good question, because it is kind of, sometimes your book like hammers stuff home and is like sulfonamides are, you know, photosensitivity, and then sometimes they just group it all together and you're like, hold on, what's up? Okay. In regards to the specific drugs, that little box that I talked about, table 29.1 on page 317, that's going to give you a good indication of some of those specific medications. So Tegretol, the drug that I cannot say, we say Tegretol, that's the brand name. It's under non-specified preparations. It's I can't say it, y'all. Carbamazepine. I just cannot get that word out. Tegretol, that is the medication that the white blood cell count should be monitored closely. Tegretol. It's a very common medication.
Okay, and also, does the book touch on, like, are these drugs specific to the types of seizures?
So yes and no. So if you look, very good questions. If you look on page 320 and you look under uses, I can definitely point that out for y'all. So hydantoins, they are often used for tonic-clonic seizures and status epilepticus. These are the big deal drugs. These are the people who are convulsing, you know, hardcore, like real. I did not call them all real seizures, but y'all know what I'm talking about. When you think of a movie seizure, you think about somebody doing this number, right? That is what these medications are used for.
Okay, I see it now.
So then when you move on to some of these other medications like Depakote. Depakote is a very valproic acid. Do y'all see that one? It's right underneath the hydantoin group. Okay, that's a very common medication. It is used for diagnosis of epilepsy. It is also used for migraine headaches and mania. So that's one of those medications. Whenever I told you guys, don't say this is your seizure medication. Not every patient on Depakote has a seizure disorder. Sometimes they're just bipolar. Or sometimes, excuse me, they just have migraines. So that's when it's important to know that not all of these seizure medications are used for epilepsy. So those are common other uses for those drugs. And then benzodiazepines, they're used, you'll see from everything from anxiety, focal seizures, status epilepticus. I'm not going to ask you guys specifically in regards to those medications because they can be used for so many different things. But what I do need you to know is don't make it just a blanket. Everybody who takes this has seizures. That's not always true. The non-specified medications are often used for focal seizures. That's on the bottom of page 320. Hold on one second. All right, I'll call you in a minute. Sorry, y'all. And then when you go to page 322, those are more non-specified drug classes. Keppra is very, very common. And again, you'll see it's used for all of the above: focal, tonic-clonic, bipolar, and migraine headaches. So the short answer to your question is no. This isn't always given for focal headache, for focal. One second. So it's not always these drugs are given specifically for this. Just knowing that they can be given for any of those types of things, and that the endpoints are almost always given for those big tonic-clonic seizures. Does that help at all? What else are y'all? These are good questions. I need to know. Oh, you're talking, Kelsey, but I can't hear you unless you were talking to someone else.
No, I was just wondering because I just didn't know how much it broke it down. Like if I was expecting to be more like all the hydantoins are for this seizure, I guess. So like, if they come in with a specific seizure, like, okay, well, this is the type of seizure you have, so you're going to get this one.
Yeah,
you know what I mean?
Not necessarily. That's kind of for a neurologist to decide. Usually we're not going to give benzodiazepines for a focal seizure. We're just going to let that pass. But it's really not necessarily, it's not across the board like it is for some other drug classes. Any other questions? Nope. Okay. In this recording,
I have a question.
I'm still listening. I heard somebody say
I was just wondering about like just seizures in general. Like they can progress, right? Like from one type to another.
Yes. And that's another good question. Oftentimes, your patient may not only have one type of seizure. I know a little boy in the area that I'm from, and he has like, I want to say like 11 different types of seizures. Like at one point, he was having, now he doesn't convulse all day long, you know, but at one point, his mother said that he was having, you know, upwards, according to his EEG, upwards of 100 seizures a day. So it's very possible to have a combination of many of these different types of seizures. And then also a good place to mention, you know, it's not effective for everyone, obviously, but there's a lot of research taking place in regards to like the medicinal marijuana and all of that stuff in regards to seizure treatment. They're seeing some, you know, some progress in that area, and it's a big area of research. So that is something that may be taking place during y'all's lifetimes of starting to see that become one of these drug classes, because it has been used in treatment for some of those cluster seizures like that. All good questions. Anybody else?
I do want to say about the marijuana, the medical marijuana. My